I'm Nicole Saphier. I'm a physician at Memorial Sloan Kettering. I'm also a radiologist at Memorial Sloan Kettering, which is a little bit more relevant to this group. So here's the thing. Before I moved to New York, I'm from Arizona. It was funny because when we were talking about what the title of this short little talk should be, we came up with personalized breast care. Are we there yet? And I mean, it's obvious, of course not, or else we wouldn't be in this room. We wouldn't be having this meeting of the minds because, what did we say, there's 130 people here? If we were really there yet, we would have 130,000 people here because we would all be on board with the same thing, bringing the same modalities to our patients. So we're not there yet. But what I want to do here is encourage you to get more involved, because often we just find ourselves sitting, listening to other people talk, and we're like, wow, these people really did some great things, or that was great how they did that. We're benefiting from that. But the point is, there's a lot of people sitting here who could actually do it and bring more to people around them. So I'm born and raised Arizona, and when I was in Arizona in training, in residency, I was at a county hospital, and we were actually shipped out to some private practices to read some screening mammograms. So I had two very different patient populations. I had a large amount of poor people who didn't have insurance or they had state Medicaid, and I was reading their screening mammograms, but I was also at the swanky private centers in northern Scottsdale. So I got to see best of both worlds. At the swanky northern Scottsdale centers, we actually had a bus. Now this was a while ago, a couple children ago, over a decade ago. But we had a bus, and it was way before all the fancy reconstruction technology. But it became very clear to me at a very young age that breast cancer screening was really like flipping a coin. I mean, everyone who looks at a mammogram with extremely dense breasts, it's like, who knows? I don't know if there's a cancer there. There could be a very small cancer in there. I didn't have 3D imaging. I didn't have ultrasound screening at the time. I mean, who knows? And then we as residents would joke about that, and as fellows we would even joke about that. And then all of a sudden it kind of clicked to me how unfair that is to the patients. And many, I'm sure everyone in this room knows the name Nancy Capello. She came to speak. I was at Mayo Clinic at the time, and she gave this wonderful presentation about what she was doing in Connecticut. And it stuck with me. And so I reached out to her, this little fellow, about how I could bring this to Arizona. And we did. She sent me a big old package of material, and we went through every step of the legislation, and we passed the density law in Arizona. And then real quick, I moved to New Jersey, and I got involved with everyone there as well, and so on and so forth. But my point is, like, I was a nobody. I was no one. I was just motivated and inspired to actually get more involved. And so when I see a lot of people not doing that, you know, I get concerned, because every person in this room has the ability to make a difference. And you're already doing ABUS, so you're ahead of the curve. When it comes to breast cancer screening and personalized breast care, you know, we try to fit people into very small, rigid boxes. We've done this very well with our breast density boxes, 1 through 4, or normal risk, intermediate to high risk, high risk. But the truth is, you look around your room, and not two people are alike. You really can't box these people up. Sure, they may have the same genetic risk factors. Sure, they may have prior surgeries, but you have to factor in their socioeconomic factors. You have to factor in, would they want to know an early cancer? You know, what do they want? And we have a lot of technologists in the room, and you are that point of contact for so many patients. A lot of times in these very busy centers, the radiologists don't even see patients. So you have to take accountability for yourself and know that you may be the only person that can save this woman's life. You educate them on why they should potentially learn more about additional screening, ask more questions. You are the one person who could really reach these patients. Radiologists, sometimes we keep our heads down. We're busy reading, but the technologists actually get that patient connection often, very often, that radiologists don't get. And so I encourage you so much to talk to your patients, get to know your patients, because you may be the only one who can give them that information. I tell my technologists, mammo, sono, you are responsible for your patient. I expect you to know this patient probably even better than I would. And they have just done so well with that. And because of that, they have brought me information that I believe has saved many lives. And if you as technologists could really take ownership of that, I truly believe that you would make a difference. And you don't have to be a radiologist to go to legislation or make a difference. You can also be the technologist. Now, I know when it comes to ABUS and some of these other technologies, it isn't necessarily at these massive institutions that are doing that. And of course, insurance companies, unless you have the large randomized controls trials, they say everything is experimental. The only way for something not to be experimental is to prove to them that it works. And if you have a small center, you may not even think to put it together, but you need to band together because multiple small centers actually make a big center. And when you're all in the same state or even the same county, all of a sudden your assemblyman or your state senator is really going to start to take notice because you take care of their constituents. So if you band together and you pool your data, you don't need this big nationalized study to prove it because it doesn't matter for you. You need to start with an N of 1, the people who are local to you. Don't worry about changing the whole thing in the nation. Focus on the patients that you serve. And whether you're in the same county, whether you're in the same state, you have to pool your data together because if you're showing that ABUS is working for you, I'm sure it's going to work for other people too around you. And if you can prove that to your legislators, you're going to get the insurance companies to pay for it. That's what we had to do with tomosynthesis in New Jersey. It was so funny to me that I had to sit and argue in front of legislators telling them, yeah, we've evolved in mammography. I'm sorry, we've gone from 2D to 3D. It's shocking. I mean, have you seen commercials go to the Pixar now? Things evolve. But because they were all hung up on the old studies, they just could not get out of their way unless I showed them a big study, and I couldn't do that. But I was able to talk some common sense into them and show them what was being done locally. And when I showed the local patients, I brought local patients, patients that were going to be voting for them, and have them talk about their lives saved. Then they actually start to listen. And so that's what you need to do. Everyone wants to think big picture, but you need to rein in a little bit and think of just the patients that you're serving because your insurance companies locally are going to start paying attention if you would just let them hear you because you're so much smarter than them. You know more about it than anyone else in the room, and you're the only person who knows what's best for the patients. And these are your patients, and you have to do what's right by them. And if you believe in ABUS and you're finding cancers, but women aren't getting it because they can't pay for it, or insurance companies aren't covering it, you're the only one that can do that for them. Don't wait for some massive national movement to make this happen. Do it locally. Your local insurance companies are going to listen to you if you start getting the ear of your legislatures. You know, this has been a very long road in breast density. I'm sure everyone knows Nancy Capello. Without her, we would never be here. And she was just one person who started this entire movement. And you can be the next person who maybe can be that one person for your state or your county or even just one patient. If you can get one cancer found in someone, you're actually saving a life. And sometimes we kind of forget that that's what we do. And our whole goal is to save lives. And if you feel like you don't know how to do that, just look around you. You have a ton of resources. You have Joanne Pushkin somewhere in this room, who's a national treasure in breast density. All you have to do is talk to her, find her at the bar, or she will help you, and she will get you anything you could possibly need to get started with the legislative process in your state. And I just want to remind you that when we take that whole Hippocratic oath and we say that we're really there for the patients, you have to take that a step further. And that means, unfortunately, getting involved with the insurance aspect. Don't bury your head in your images, because if your patients can't afford it, then who cares? Because they're not going to get it, and they're going to have more advanced cancers. And so you can't depend on the manufacturers or some great one person to pass something nationally. You have to be that person for your patients because you're not really helping them if they can't cover it or they can't afford it or if they don't even know about it. And the primary care doctors around you, they don't have time to ask all these questions. They are so inundated with patients and paperwork right now that you have to take ownership of these patients. I know we get busy, with all of the screeners. If you've got a bus, then there's a good chance that maybe you're also screening for risks. Start taking responsibility for your patients. Don't depend on your ordering clinician to order the right thing. They do not know what they're doing for the most part. They're depending on you to guide them. That is your specialty. And you should not hesitate. You shouldn't say to yourself, oh, this person could really benefit from an ultrasound. Move on. Call them, tell the patient, pick up the phone, call their doctor, educate them, because it starts with you. And radiologists need to get out of the dark and into the light, and maybe we'll just continue to save lives, because we are going to advance the way when it comes to breast cancer screening. We certainly can't depend on the government, and we certainly can't depend on other societies, like even the American Cancer Society, because they're all just trying to get mass screenings happening right now, but it is not being tailored to the person. So the personalized care and screening is going to come from the radiologists and nowhere else. And so you have to take ownership. And I just implore you to be active, move forward, and if you need any help or you have questions, you have a plethora of support around you. You just have to band together and work together. Okay? Thank you for having me.